Hello, dental colleagues. Today, we are diving into an exciting advancement in periodontology, stem cell biology in periodontal disease. Together, we will discover how these tiny, powerful cells could advance the way we understand and treat gum disease.
Stem cells are like the body's ultimate shapeshifters. They can copy themselves and transform into many different cell types, such as muscle, nerve, and even bone. While embryonic stem cells can become any cell in the body, adult stem cells are the specialists, living in tissues like bone marrow and gum tissues. You can think of it as a built-in repair crew. Patients with injuries, people with chronic diseases, and even those needing dental and tissue repair would be benefit from it. Some fun facts of stem cells. In your mouth, those cells can rebuild bone, ligaments, and gum tissues lost to disease. They are found throughout the body, even in teeth. Special types like periodontal ligament stem cells can transform into bone, cementum, and ligament cells. And research shows that they can actually regenerate these tissues. Pretty amazing, right? We have learned that stem cells are everywhere, even in our teeth. Now let's zoom in on adult stem cells and see why they are game changers. These cells come from mature tissues like bone marrow, fat, and even umbilical cord tissue. What makes them amazing, you asked? Well, they rush to areas of inflammation to kickstart healing. They can transform into specialized cells like thick bone, ligament, and so much more. And the best of all, they are proven safe for clinical use. This is why they are at the heart of groundbreaking regenerative treatments, including those in dentistry. In this video, Dr. Joe Nemeth, a periodontist, explains how stem cells could transform dentistry, their current applications, and their future possibilities of regenerating teeth.
There is research being done now at the University of Pennsylvania, Tufts University, and I think other institutions around the United States, possibly around the world, on utilizing stem cells, human stem cells, to build and grow bone or revive actually dead teeth. Now, there are 5 different sources of stem cells in the mouth around teeth. There are stem cells from the ligament or that's the tissue between the tooth and the bone. There's stem cells in the pulp or in the center of the tooth where the blood supply and the nerve are. There are stem cells around a follicle or a baby tooth that's developed before it comes into the mouth. And there are stem cells at the tips of the roots of teeth. So there are a number of sources of stem cells. These institutions are trying to see what they can develop with the stem cells. I think in some cases they're actually implanting them in the bone and actually growing teeth. Well, my ideal would be to take some of these stem cells, maybe from the ligament between the tooth and the bone, and somehow be able to activate them so that we can get new bone and new attachment to the tooth that's losing bone from gum disease. So once we clear up the infection, if we can stimulate stem cell growth in that area, which can then stimulate bone growth, it would be a huge, huge advance. And I think someday it may happen. Right now, we don't really have anything that is really practical for doing that, but there's ongoing research. I'm very interested in it. A friend of mine in Florida, Dr. McCauley, is very interested in it. We're going to be doing some more work and research to try to find more about what possibilities there are, and certainly I'm going to keep you updated on it. But I know stem cells are an exciting new area of research. People are interested in them, and I just wanted to talk about them a little bit and what is so far starting to happen in dentistry. Please join our YouTube channel, subscribe. We'd love to hear from you. Any comments or questions? I'll try to keep you abreast of everything that's going on in dentistry and maybe some things that are outside of dentistry. So Keep your mouth healthy. You're going to have a healthier body. Have a great day.
Periodontal therapy helps restore damaged tissues and prevent tooth loss, making it an important treatment for managing periodontitis. Stem cell therapy offers exciting potential for regeneration, with studies showing benefits in clinical attachment levels and pocket probing depths. However, periodontitis remains highly prevalent and costly to treatment, impacting many people's quality of life. Stem cell therapy also faces limitations, as human studies are still limited and more research is needed before it becomes a routine treatment option. Recent advances in periodontology have shown that stem cell-based therapies are opening up new possibilities for treatment. This research, which includes systemic reviews and meta-analysis, suggests that these therapies may help important outcomes such as clinical attachment loss, probing pocket depth, and bone regeneration. However, these results are less promising when it comes to gingival recession and the distance from the cemental enamel junction to the bottom of the defect. This means that while stem therapies hold great potential for periodontal regeneration, they may not qualify effective in every area. More studies are needed for a better understanding on how to use them more effectively in clinical practices.
Today, stem cells in periodontologies are mainly used in research and clinical trials. Some dentists use cell-based therapies in advanced regenerative procedures, often combined with bone grafts or guided tissue regeneration. Stem cells are also being explored for generation, periodontal ligaments, alveolar bones, and even cementum, offering potential solutions for severe gum and tooth-supporting tissue loss. Additionally, they may help in modulating inflammations and promoting faster healing after periodontal surgery, paving the way for more predictable and long-lasting treatment outcomes. The future of stem cell biology in periodontal disease. Stem cells research is transforming periodontal therapy, shifting from repair to true regenerations of lost tissues. Personal stem cell therapy, we are autologous cells harvested from the patient's stem cells for better outcome. This reduces immune rejection and in the future could involve gene editing techniques like CRISPR to enhance our regeneration. Off-the-shelf therapies, our research is developed in allogenic MSCs ready for clinical use. This uses a donor with a harvesting a patient's cell, helping treatment become faster and more cost-effective. Stem cell banking. Biobanks are another emerging approach. DAPSCs, dental pulp stem cells, or PDLSCs, periodontal ligament stem cells, from extracted teeth like wisdom teeth, can be restored for future use. This can provide personal regenerative resource for future periodontal or even systemic treatment. 3D bioprinting and tissue engineering. With 3D bioprinting, stem cells can be combined with scaffolds and grown factor to recreate the exact structure of periodontal tissues, such as bone, ligament, and cementum. This provides access to precise and patient-specific tissue reconstructions. Exosomes and cell-free therapy. This uses exosome from stem cells instead of the whole cells to repair tissue, making it safer, easier to restore, and less likely to cause trauma. There is also immunomodules and inflammation control. Stem cells can help regenerate the destructive immune response in periodontitis. Future treatments may shift the disease environment towards healing and not just tissue repair. AI and digital integration, using AI and 3D imaging care plan treatment that matches each patient with the best stem cells resource. and scaffold designs for precise tissue regeneration.
Interesting information. Stem cells can differentiate into multiple cell types, including bone, ligament, and cementum cells, making them ideal for regenerating the complex tissue of the periodontium. Cell homing. Scientists are also exploring ways to stimulate the body's own stem cells to migrate to the site of periodontal damage, a process known as a stem cell homing, to promote natural healing. Stem cell therapy. Stem cell therapies can be more effective than traditional treatments in some cases, potentially improving clinical attachment levels and pocket depth. Questions. How stem cells work to repair periodontal tissues and why are they so important? They promote tissue repair, regulate the immune response, and transform into different types of cells and repair damaged tissue. They are so important because they hold the potential to regenerate bone, gums, and ligaments that are lost due to periodontal disease, regenerating and repairing the structures. What are the mesenchymal stem cells and why are they important for periodontal disease? Mesenchymal stem cells are derived from umbilical cord, bone marrow, or adipose tissue. Are cells that have the ability to differentiate periodontal ligament, cementum, and alveolar bone, making them the most promising therapy in periodontal regeneration. Could stem cell therapy one day replace the periodontal surgery? Stem cells may significantly reduce the need for invasive surgery, regenerating periodontal structures, which is the main goal for surgical repair. Although these surgeries require access, clean, and reshape bone to remove the infection, stem cells could help to less invasive treatments, but not to completely replace periodontal surgery.
Thank you for watching. Stay curious and keep an eye on stem cell breakthrough. These tiny cells can be a big future for periodontal care.